Okay, so I'm here with Beth Hacker, who is a CNA that worked in the Alzheimer's unit. So first of all, I want you to kind of give us examples of what your experiences are with people with Alzheimer's.
Well, I used to work down in the unit at St. Anthony's nursing home, and there was all different sorts of people with Alzheimer's. You had your wanderers, you had the ones that just yelled out because they didn't know, and then you also, there's so many different varieties of Alzheimer's.
What were some of the things that you guys used to kind of stop the people from wandering out of the building?
They have doors that have codes on them, and only the staff know the codes to let people in and out. That way, the people, because they look like normal people, so that way family members would know who were actually residents and who were not. They also have alarms so that you know that those people aren't getting out.
And then when I was down there, they had pictures on the doors. Is there a point to that? Does that help?
A lot of times with Alzheimer's, they think they go back to their younger years. So by putting a picture of them at their age of 80, they aren't going to know who they are. So a lot of people, you put a younger picture in because that's what they refer back to as their younger years. And then also they put sceneries on the doors to kind of distract them so they don't know that they're doors.
And do you notice how the family members are affected by this?
It's hard on families because a lot of times in the later stages they don't recognize their daughter, their grandchildren, their spouses, and it's hard for especially spouses to come in and not be recognized.
Have you ever had any personal experiences with Alzheimer's?
My grandpa had it. He had it later in life, probably around, late 70s, early 80s, but in his final months especially, you could just gradually tell. He never called his wife by, Mom or Arlene. He called her by Lady in Blue, and, he just kind of went along with the conversation, whether you were his granddaughter or not.
So with your experiences with these people, is it hard to deal with them, working with them? Does it make it more difficult?
With them, you let them do what they're going to do. You can't, no matter how you try to convince them that it's 12 o'clock. If they're not hungry, they're not hungry. So you are on their schedule and not on our schedule. If you argue with them, all it's going to do is agitate them more.
Do you think it's harder to work with the Alzheimer's patients more than it is with a regular nursing home patient?
Some days. It depends on if there's a full moon. It just kind of depends on their mood. It's like anybody else.
Okay, well, thank you for your time and your expertise.